Hi, my name is Dr. Jeremy Fritz. I'm the Executive Director of Brain Balance Chicago and Milwaukee, and we're going to go through just a basic brain balance overview. We start off with resource books, Disconnected Kids and Reconnected Kids, which were written by our founder, Dr. Robert Malillo, the developer of the program. Disconnected Kids is actually written for two main reasons. Number one, for people that don't have a brain balance in their backyard that are trying to do a home program. And number two, we use it as a companion guide for parents that have kiddos within our program. Reconnected Kids is written specifically to be able to allow parents to understand developmentally where their kids should be. And even after the kiddo's brain is actually balanced, we look to try to help recognize that we need to develop the child's brain because they missed out on many things developmentally because their brain was out of sync, out of balance. So therefore, things in essence that were taught were not necessarily learned. So many of you are here because you have a child that is struggling on the spectrum. You are not alone. The numbers have been increasing in epidemic proportions. We realize that autism was diagnosed approximately 1 in 10,000 2 to 3 decades ago, and we have staggering numbers. In the United States, it's now 1 in 88. For boys, 1 in 54. And for places worldwide, like in Korea, we have numbers as low as 1 in 20. ADHD has gone up approximately 25% in the last decade. We recognize numbers to be approximately 11 to 15% of the population for ADHD. Collectively, when we put all of these problems together, guesstimates range from as low as 15 to 30 and maybe even 40% of our kids exhibiting characteristics that would be under the umbrella of neurodevelopmental / behavioral / learning disorders. So what we need to recognize is that here at Brain Balance, we are all about understanding what is happening within the brain. And we are all about understanding what is happening with your kiddos. So number one, we recognize that these are functional brain imbalances which require a specific brain-based approach. We believe that your children can improve, and we need to be able to address the underlying issues. I've seen approximately 500 kids come through this program, and I know without hesitation that we can actually make improvements because I've seen it day in, day out. So the first thing that we ask at Brain Balance, and really what Dr. Malillo asked, is what is happening inside of the brain of your child that allows them or doesn't allow them to function normally, but causes them to function in a way that would give them a diagnosis of things like ADHD, dyslexia, learning disabilities, autism, and the like. And there are leading scientific theories. So can you describe any of the leading scientific theories as to what makes a child autistic, ADHD, dyslexic, and so on and so forth? And really, if you have your child already diagnosed, what has your pediatrician told you? What has your psychologist told you? What has your psychiatrist told you? So, if you are unable to answer that question, then how are you going to be able to determine if and how your child's condition can improve? How can you be sure that you are utilizing the best approach to tackle the problem? The answer is that you can't, because if you do not understand the nature of the problem, the solution is impossible. You're just going from one place to the next. And we really need to understand the problem, and that's where the paradigm shifts here at Brain Balance right from the get-go by number one, asking that question, and number two, being able to answer that question. So, how is it possible that your child can be diagnosed with ADHD, autism, dyslexia, learning disability, Asperger's, OCD, or another way to put it, if your child has been diagnosed with a disorder, how is it that they exhibit characteristics within all of these different disorders? And really the answer is that they all have the same underlying brain regions involved. So I'm just going to cut to the chase because this is a really quick overview. In the literature, what we recognize is that functional disconnection is the problem. Okay? The problem is such that one side of the brain has developed faster than the other side of the brain. The two sides of the brain are then not able to actually work together due to the fact that one side is processing more quickly than the other side. This leads to what I call dysfunctional dominance, such that the strong side takes over due to the increased processing speed. Or another way to think about it is the dysfunctionally dominant brain takes in the information, processes it, comes up with an answer, and therefore provides the response before the slower processing brain is even able to have input. So this creates what we call a functional age gap between the two hemispheres, and we've seen things where we have a 10-year-old child that can have a 15-year-old functioning brain hemisphere on one side and a 5-year-old functioning hemisphere on the other side, creating a 10-year functional gap within a 10-year-old child. So this disconnect is the actual problem, this functional disconnection. And I say functional because it's not a structural lesion, okay? It has to do with a timing difference that doesn't allow for the two sides to be able to link up in real time. In essence, not allowing for the weak side to actually play a part or play its role in determining what it's supposed to do from moment to moment. So we look at this disconnect and we explain your child's issues through the lens of the weak hemisphere and the strong hemisphere. So in essence, this functional disconnection is the guiding light through which explaining what the problems actually are. So to do this, we need to recognize that the right brain and the left brain are responsible for doing different things. They see the world differently. So the left brain is about logic, linear thinking, language acquisition. It provides things by looking at the details, by explaining things literally through verbal communication. It's about word reading and calculation and processing information, whereas your right brain is your big picture brain. It's there to be able to describe things on more of an unconscious behind the scenes level by picking up on nonverbal cues, by being able to recognize what somebody is saying not by their words, by their movements. It's what we would call the emotional brain. It picks up on the deep-rooted unconscious emotional drives that are rooted within body positioning, posture, and so on and so forth. So, if these two sides are not developing appropriately at the same speed together, we recognize that the brain is going to be out of sync. So on the left here we see a brain that is underconnected with further activity on one side versus the next, and you can see that the whole brain itself is underactive relative to the brain on the right here, which is recognizing that it is, or as we're recognizing the synchronization and the overall activity that is occurring within the brain at large. So if your child has a functional disconnection, they will exhibit the ABCs. It's impossible not to. If the brain is functionally out of balance, I expect to see the ABCs. It doesn't mean that you will have all of them, and it doesn't mean that every child exhibits them to the same degree. So the ABCs of functional disconnection are attention, academics, as well as anxiety, behavioral, emotional problems, cognitive, coordination, communication, socialization, and sensory issues. So we further differentiate these problems by understanding that we can have left brain hemispheric issues and right brain hemispheric issues. So therefore, we recognize that kids that have their left brain less developed are typically kids that would be diagnosed with things like dyslexia, processing disorders, language disorders, and really things that would be considered learning disabilities. So many of these kids are going to exhibit these problems because the left brain is responsible for certain tasks. So the left hemisphere itself is responsible for reading and writing and speech and language acquisition and so on and so forth, like we said earlier. So you can see the problems listed here are coherent or coexist because that side of the brain is responsible for those tasks and it's underdeveloped. So poor reading, delayed speech, poor auditory processing, poor object identification, poor verbal communication, depressive aspects, poor math operations, graphomotor, fine motor problems, cross-laterality, meaning they don't know their rights from their lefts, decreased immune function, all of those things. Right hemispheric delays, on the other hand, are actually going to be problems that typically would provide a diagnosis of autism, Asperger's, ADHD, Tourette's, OCD, and the likes. Why? Because the right hemisphere itself is responsible for the very things that would be causative in labeling these problems. Meaning, a child that has right hemispheric problems, they struggle with knowing where their body is in space. They struggle with spatial orientation, with being able to determine where their space bubble is in relation to other people. They struggle with getting the gist of the story. They struggle with recognizing whether somebody is joking or not joking. All of those things are filtered through the right brain. If it's underactive, the right brain itself will not be able to light up as quickly. Therefore, their world is seen through a left brain strength. So the left brain is literal. So in relation to the right brain, if the right brain is underactive, the left brain is overactive. So we recognize that this can create problems like attention, impulsivity, perseverative behaviors, getting stuck on a specific thought, creating a compulsion for that. Another way to think of these problems is the right brain is the brakes of the brain, the left brain is the gas pedal. So we have this challenge in a kid that has ADHD that they're moving all the time, that they jump in and they're impulsive about making a decision because they can't take a step back and pause for a moment to have what we call response flexibility, to be able to be flexible in what it is that they and how they want to respond. So at Brain Balance, we have specific testing that helps understand the significance of the primary brain imbalance. First and foremost, we look at these problems as the brain imbalance, the functional disconnection is the primary issue. We then recognize that there's attention, academic, behavioral, emotional, cognitive, socialization issues. What you have to recognize here is I broke this up into 3 categories to help you understand that many of the therapies and the things that you will seek out focus in on one specific area. So if I have in the left-hand box here academic attention areas, those are secondary problems. And if you only focus in on addressing those things by doing a behavioral or academic or attentional-based program, the results are going to be limited because you don't necessarily address the underlying issue from a functional brain imbalance. As well as we can look at the behavioral and emotional components and the cognitive and socialization issues. So the ABCs of brain balance are simple. We need to assess for the underlying brain imbalance. We do that through a comprehensive, specific program testing that I will get into next. We then have a program that's individualized to balance the brain specific to the weak hemisphere. We then coach you, the parents, through this program, and then we help you set goals and come up with a game plan for future development. So the way this looks is we have this brain balance assessment which determines, in essence, the functional brain age of your child. We do this by comparing the function of various parts and departments within the brain, first to their peers, and then most importantly to themselves hemispherically from one side to the next. We do this in a sensory motor, neuroacademic, and developmental intake. All three of these collectively come together. The sensory motor is there to help us understand the number of circuits that are involved, which will help us determine the severity of the problem. The neuroacademic component is there to help us understand the hemispheric gap in both the academic and the cognitive components. And the developmental intake is there to help us understand really how invasive is this problem. So you as the parent help us understand, and we help you understand then when this thing actually started and how it has affected their development at large from early on. So all of these problems will be pointing to the same thing, functional disconnection. Or to say it differently, the way that Dr. Malilla designed this assessment was so genius because it incorporated the understanding of what the parents are telling us, which is what most people only focus in on for just a history. But number two, the sensory motor distribution or sensory motor gaps with the neuroacademic gaps. And if there is a functional disconnection, all three of these will be pointing to the functional disconnection, which then is the lens through which we see the ABCs of functional disconnection, those attention issues, those academic issues, those anxiety issues, behavioral, emotional, cognitive, and the likes. So the program itself is then built individually from the testing within a sensory motor, neuroacademic, and the third pillar of the program, a nutritional guiding light. We are a supplemental learning center or a specialized learning center that specifically assesses to see if there's a functional gap in the brain. We determine which side of the brain is actually weaker or how many parts are underactive and disorganized. We then create a sensory motor, neuroacademic, and nutritional game plan to be able to address the underlying issues within your child's problems. So there's 10 unique principles about brain balance. Number one, it's a brain-based approach. Number two, we have to assess and address functional disconnection. A hemispheric-based program is the key. We are the leaders in addressing this thing from recognizing that functional disconnection is going to reveal itself with one side of the brain being underactive. So we need to actually activate the weak side, not the strong side. Problems can continually improve. We know that kids can get better. We need to first measure and fix the actual function, not focus on a symptomatic program. To do that, we need to have this complete individualized assessment. We need to fix all of the functional problems, not leave just one or focus on one area or another area. This is an integrative problem that is brain-based, which incorporates multiple different issues within, and we need to find out what your child's problem is and address all of those things collectively as a whole. Now, that doesn't mean that all of their problems in the ABCs will be remediated. We're talking about functionally addressing the underlying brain-based issues, which is the prerequisite for all other appropriate learning. We need to do this in what we call same-time integration, which means we need to collectively assess all of those individual areas. And we've created a multimodal program which allows for us to be able to activate all of those things at the same time to build the platform together. Number 9, brain-body balance. We recognize that the brain and the body are in continual communication. If there's a functional brain imbalance, all other body systems will be actually affected. So we need to recognize this and integrate these things together. Lastly, children require a different approach. We specialize and only work with kids from 3.5 to 17, and the program is unique to kids because really this is where these problems all start with our kids. These are childhood developmental problems, and we want to get to them as fast as we can. So I encourage you, check out Brain Balance, go sign up for an assessment, find out exactly what it is that is happening inside of the brain of your child, and then we'll be able to determine how and when and how long we're going to be able to help your kid. Thanks much.